Our next speaker is from Tehran. She is Vahideh Gavgani from the Department of Medical Library and Information Sciences, Faculty of Paramedicine, Tabriz University of Medical Sciences. And her talk is on how information prescription works in cardiology departments.
In the name of God, the gracious, no one can measure. Thanks to all of you for a good presentation that I really used them, and I'm happy for being here. What I'm going to present is just my experience for about prescription of information, not my experience, the experience of our team, including doctors, cardiologists, and I as an information specialist, and my colleagues and nurses. Prescription of information to patients with coronary artery diseases, a practical experience of information therapy in a developing country. Before going to the presentation, I'm going to give a brief explanation of information prescription. That's a provision of a specific evidence-based health information to a specific individual patient to help him or her understand, manage, and control their ill health. Information prescription requires active participation of patients in healthcare process. It promises that information intervention may boost the healthcare outcomes, reduce the medical errors, and undertake the patient's right. Information prescription is now considered as part of patient care process. Requirement for fulfillment of IPs relies on the three components. One, health information technology, HIT, or availability of health information system and integrated electronic medical records. Second, patient's involvement, and the last, physician's interest. Objectives. The main objectives of this project was provision of IPs for patients with cardiovascular problems hospitalized in Shaikh Madani Heart Hospital in Tabriz city of Iran. It aimed to detect the barriers and requirements for filling IPs in non-wired condition and reach to a sustainable and applicable model for fulfillment of IPs in developing and non-wired countries. Because in my country we are not using HIS and we are not wired, and we don't use integrated health information system. So we wanted to experience information therapy and IPs. The method and materials. 2 cardiologists and 1 information specialist, along with 2 assistant information specialists, 2 residents of cardiology, and a nurse were hired as a team to accomplish IPs. From October 2010 to February 2011, patients hospitalized in intensive care unit of Shaikh Madani Hospital received physician-prescribed IPs. Information specialists filled the IPs using reliable evidence-based information sources and standards of patient information. Residents and nurses administered or presented IPs to patients after physician's approval. The sources that we used: Medline Plus, MD Consult, RX List, Kaiser Permanent, myclinics.com. At first we gathered information about the subjects, cardiology, and then we translated them into Persian language, our own local language, vernacular language, and then simplified them and made them according to the standards that they are written in the Discern, and then we stored them in our database. The criteria for IPs: we use Discern questionnaire criteria to build the structure of IPs, and also IX standard using IX standards that is available in Kemper and Mettler's book. Before going to this result, I want to say that gap I think is there. I missed to say that after the storing the data in the database, in any time that we wanted to go to the round with the physicians and the other colleagues, we joined to the medical team and went to the bedside of the patients, and then cardiologists, they prescribed the information, and we were there also. We were written the aspects as they were talking to each other. Then we went to retrieve the data and personalize them according to the case of the patients, and then we submitted them to the cardiologist. They approved. After approval, they were distributed or presented to the patients. So the immediate result of the information intervention in shared decision making was that total number of patients received IPs were 95. One rejected angioplasty after being informed about the harms, side effects, benefits, and the choices they may have. Almost total number of the patients were satisfied with IPs. Only one of the patients said that the length, quantity of the information is much and boring. Total prescriptions included topics on MI, stent and stent replacement, placement, diabetes, exercises, efficient, warfarin, PCI, angioplasty, coronary artery diseases, and artery bypass grafting, heart attack, and so on. Findings. HIT manifestations like internet access, social networking tools, mobile phone technologies, and are widely available for patients and physicians equally in developed countries. In such IT-based environment, patients are either seeking health information or have access to the net to communicate with their physicians, receive IPs, search for health information, and share their story and information with their network. Despite of patients' preference and interest in receiving IPs, there are limitations for fulfillment of IPs in developing countries like Iran. Access to the internet, electronic and integrated health records, patients' information portals, availability of computer for individuals, health and computer literacy are inconsistent throughout the country. Therefore, it is essential to adopt both traditional paper-based system and information technology along with emerging IT-based tools to ensure sustainability of IPs. The problems that can be categorized in three, including time, health information technology, and training. At times, the biggest barrier to accomplish IPs in non-wired country like Iran and non-English language country is lack of patient information system in vernacular language like Persian. At least a patient information database is a significant factor to store, retrieve, and personalize information in local language at the moment of care. That's all. Thank you very much.